Here is a vein. The vein has three layers of tissue. The outer connective tissue, which is called tunica externa, tunica media in pink, which is made up of smooth muscle, and the tunica interna, that is shown in blue, which is made up of epithelial tissue. The inside of the large veins also carry valves. That's what you see in the center. These valves are very important because they help to prevent backflow of blood. The veins always carry blood back to the heart, and so there might be some backflow of blood, especially when you're taking blood from your feet all the way to your heart. There is another problem when a person has a job where they have to stand for long periods of time, and that problem is varicose veins. So if you are a dental hygienist or a hairdresser and stand for long periods of time, then varicose veins might be a problem because these veins are become very tired, and the treatment given is support stockings. Support stockings help to increase the blood going back to the heart, and we call this movement of blood back to the heart, we call it venous return. If you are sitting for long periods of time or laying on the couch for long periods of time, your venous return is much lesser than if you were walking. So what happens is that you get less circulation, and so you feel worse. The problem here is gravity, because when you're sitting for long periods of time, the blood has to move back to the heart against gravity. The way you can fix this is by elevating your feet or by exercising, which is the best thing you can do for venous return. There are 5 mechanisms that help to increase venous return in the body. The first one is gravity. When you're dealing with blood returning from all parts of the body above the heart, then gravity is a huge help. It has a positive effect on venous return. If you're dealing with blood coming from your feet, then gravity is of no help. It is actually a hindrance. It has a negative effect on venous return. So here we have it. Gravity only helps with venous return of blood coming from areas above the heart. It also helps if you're doing yoga and you've got your feet elevated. When your feet are elevated, then gravity is a huge help, and blood can return to the heart fairly easily, thereby increasing venous return. As you can see in this picture, there's your yellow line showing venous return from the feet back to the heart, helped by gravity. The next factor that helps venous return is pressure gradient. This is a profoundly important factor because it helps the flow of anything: water, air, blood. In this case, we're talking about blood, and so the flow of blood is always from a region of high pressure to a region of low pressure. And we call this down the pressure gradient. We say that blood flows down the pressure gradient. So let's take a look at the movement of blood from the feet all the way to the heart. Yes, it's moving upwards towards the heart. However, in terms of pressure, it is moving from a region of high pressure in the feet to a region of low pressure in the heart, in the right atrium where it ends up. So let's trace the pressure changes from the feet all the way to the heart. P is for pressure in this flowchart. So the pressure in the venous plantar arch is greater than the pressure in the tibial vein. The pressure in the tibial vein is greater than the pressure in the popliteal vein, which is found at the back of the knee. The pressure in the popliteal vein is greater than the pressure in the femoral vein, which is in the thigh, going upwards. Pressure in the femoral vein is greater than the pressure in the external iliac vein, which is in the pelvic region. The pressure in the external iliac vein is greater than the pressure in the common iliac vein, which will now join the inferior vena cava. So the pressure in the common iliac vein is greater than the pressure in the inferior vena cava, which is a very long blood vessel, and the pressure in the inferior vena cava is greater than the pressure in the right atrium. So in this way, blood keeps flowing from a region of high pressure to a region of low pressure. The third factor is the skeletal muscle pump that helps to increase venous return. This factor has everything to do with exercise. When you exercise, your venous return increases and makes you feel a whole lot better. Whenever you exercise, your muscles contract. When they contract, they increase the blood flow up the leg towards the heart by squeezing against the neighboring blood vessels. So whenever you exercise, muscles contract and squeeze the veins, and that increases venous return back to the heart. So let's review that one more time. Whenever you exercise, your muscles will contract. The greater the exercise, the greater the contraction. The greater the movement, the greater the venous return. So your muscles, skeletal muscles contract. They squeeze against the neighboring blood vessels, which are veins, and these veins respond by pushing the blood upwards towards the heart. And this increases venous return, which is why when you are sitting on the aeroplane for long periods of time, you must do those exercises they tell you to do because it increases venous return. If you don't do that, you may have issues with blood clots in the vein. So you want to keep the blood constantly flowing and constantly have the blood moving upwards towards the heart. But remember, the blood always flows down the pressure gradient. I would like you to take a deep breath and exhale. You have just increased your venous return. We call this mechanism the respiratory pump because every time you take a deep breath, your diaphragm moves down and your rib cage moves out, and you create more space in your chest cavity. So in other words, your thoracic volume increases, and you know that when volume increases, pressure decreases. So your thoracic pressure decreases, allowing air to move in from the outside down the pressure gradient. What it also does is to increase your venous return. This is because the pressure gradient or the pressure difference between the abdominal IVC or inferior vena cava and the thoracic IVC has just increased. Every time you take a deep breath, the pressure in the abdominal IVC is greater than, much greater than, the pressure in the thoracic IVC because you have just decreased the pressure in your thoracic IVC so much more by taking a deep breath. This allows blood to move much more easily from the abdominal region to the thoracic region and into the right atrium. Not only have you increased the amount of oxygen that has reached your lungs by a deep inhalation, but you have also increased the venous return. Remember, increased venous return always makes you feel a whole lot better. So here's your take-home message. With every deep inhalation, you increase venous return. The last mechanism for increasing venous return has to do with the opening of the AV valves, the tricuspid and the bicuspid valves. We call this the cardiac suction pump. When the AV valves open, blood is sucked into the ventricles in a great force, and this creates a vacuum in the atria. And this vacuum allows to pull very strongly the blood from the inferior vena cava into the right atrium. We talk about the right atrium here and not the left atrium because blood coming back from the body is much more challenging than venous return coming back from the lungs, where it happens fairly easily. So whenever the AV valves open, blood is sucked into the ventricles. There's a sudden movement of blood into the ventricles. This creates a vacuum in the atria, and this vacuum allows more blood to be forced into the atria from the inferior vena cava and the pulmonary veins. But we are concerned with the inferior vena cava because venous return from the body is a lot more challenging. When there is insufficient blood reaching the vital organs, it can lead to death. This type of condition is called circulatory shock. There are several kinds of circulatory shock, and we're going to look at three of them. Hypovolemic shock, which means shock due to low volume of blood. This can happen due to trauma or injury and blood loss. The next one is anaphylactic shock, which is caused by an allergic reaction that is very severe. The third type of shock is called septic shock, and this is caused by a bacterial infection. Each one of these shocks lead to death in a matter of minutes to hours to days. We're going to take a closer look at each of these types of circulatory shock. Let's take a close look at the process of anaphylactic shock. Anaphylactic shock is caused by an allergen. Some people have a severe reaction to an allergen. The allergen could be peanuts, shellfish, dairy, or a wasp sting. When the body is exposed to this allergen, large quantities of histamine are released. Histamine is a chemical that makes everything leaky. It makes capillaries leaky, and it causes the arteries and arterioles to dilate hugely. There is a massive vasodilation in all the arteries and arterioles in the body. When there is a dilation in an artery, the space inside the artery increases. Remember, we said volume increases. When volume increases, pressure decreases. So the pressure inside the arteries decreases. As a result, because all these arteries have lowered pressure, peripheral resistance goes down significantly. We call this peripheral resistance because these are the arteries and arterioles that are peripheral to the heart. So the peripheral resistance goes down. Whenever peripheral resistance goes down, blood pressure always goes down. So there is a huge drop in blood pressure. We need blood pressure to pump blood to all the vital organs, especially starting with the head, because you need more pressure to send blood to the head. So blood to the brain and other major organs like the liver and the kidneys goes down greatly, so it's not pumped to the vital organs, and that leads to death. We call this anaphylactic shock. The treatment for anaphylactic shock is epinephrine. Epinephrine is another name for adrenaline, and it is given to the person in the form of an EpiPen. If a person has an EpiPen, they can use it right away. Otherwise, it is administered intravenously. Epinephrine is a potent vasoconstrictor. If you remember, histamine causes vasodilation, epinephrine causes vasoconstriction. So it opposes the effect of histamine and it brings things back to homeostasis. It goes back to the normal blood pressure, and blood can now be pumped to all parts of the body. So it reverses the effects of histamine and brings the blood pressure back to normal. The next type of shock that we will look at is septic shock. Septic shock is caused by a bacterial infection. It is very common in nursing homes and among patients who are immobile. These patients develop what are known as pressure ulcers, which are lesions in the skin, and this can lead to septic shock. So let's take a look at how a pressure ulcer can lead to death. So here we have the pressure ulcer. The pressure ulcers are infected by a particular kind of bacteria that always lives in the skin called Staphylococcus bacteria. You may have heard the name staph infection. So this bacterial infection is caused by Staphylococcus bacteria or staph bacteria. Staph bacteria, once in the bloodstream, release toxins, bacterial toxins. These bacterial toxins cause massive vasodilation. We saw that earlier with the anaphylaxis. In the same way, massive vasodilation results in a drop in peripheral resistance. So there is an overall drop in peripheral resistance in all the arteries and arterioles. And when this happens, it results in blood pressure going down. So there is a severe drop in blood pressure because there is a severe drop in peripheral resistance. So when the blood pressure goes down, there is not enough pressure to pump blood to the vital organs, resulting in the treatment for septic shock is antibiotics. Antibiotics are chemicals that work only against bacteria. So the patient is given antibiotics intravenously until the blood pressure goes back to normal and all vital statistics return to normal. The third type of shock is hypovolemic shock. Hypo meaning less, volemic meaning volume. This means the blood volume has become dangerously low, leading to death. This is caused often by trauma. So if a person has been injured and is suffering a great deal of blood loss, hypovolemic shock is the result. So when there is a large amount of blood loss, blood volume goes down greatly. So when blood volume goes down, blood pressure goes down as well. Blood pressure goes down greatly. And now there is not enough pressure to pump blood to the vital organ. And this results in the treatment for hypovolemic shock is blood transfusion. Blood has been lost, so blood must be replaced.